Hi guys, Dr. Ray from Chiropractic Plus, and I want to spend a few moments talking about the spinal correction, the home care. Now, this is one of the most crucial elements to the success of your health restoration and the optimizing of your life. So I really want to stress to you that you need to do this. Now, it's twice a day, 7 days a week. Now, you've got a home correction kit pamphlet. Inside of it is exactly what you're supposed to be doing based upon what your x-rays demonstrate. So follow this book to the letter of the law. And as I want to stress to you, any confusion, please ask a team member and they can coach you through. Now, ultimately, the exercises will be developed from this sheet. Now, the doctors put this sheet together and then the staff translates it here so you get the exact exercises your body needs. So when it comes to spinal correction, some of the things you need to be doing. Number one, Angie, if you'd mind coming over and demonstrating. We're going to be using 2 rolls. Now, there's 2 of them in your kit. One is a very thick one and the other one's very thin. Now, one is more dense. Now, there's another set that are more dense. Start with the softer rolls. Now, it seems backwards, but I want you to use the bigger roll in the neck and the smaller roll in the lower back. Now, I'm going to show you where I want you to place those. Angie, I'm going to move your hair so they can see your neck. Okay? Now, where I want to place that roll is approximately here. Now, what this is doing is it's actually molding the ligaments. There's 3 steps to the correction process. The mixing, which is the warm-up, which we'll get into in a little bit. The fixing, which is the adjustment, and the locking, which is the vibration in office and the use of these various wedges and molds and sleep aids. So that will be sitting right here as you're laying on your back. You do that for approximately 20 minutes and you keep increasing. Now, if you ever get symptoms from this, please stop and then just check your timing and just work it up. Build up slowly because it is a correction process. So that would be the neck roll in your lower back. You're going to place it, again, approximately the height of your hips, but it depends upon you, and the best place to put it is kind of where it falls. So lay on your back like so. Now, the next thing we're going to demonstrate is the placement of the blocks, and this is probably the most confusing part of the entire process. Now, what I want you to do when you get home is you're going to find the tops of your hips, and Angie's demonstrating for us right now. That's where the top block will go. Now, the top, it can be either placed up on this side or on this side, depending upon what has been recommended by the doctor. So I'm going to go ahead and demonstrate this side. Now, the wedges are 90-degree angles, and that's what will be towards the floor. So it's not going to be the other direction. That's a 45, that's a 90, and we're going to place that right on the top of her hip where she has her thumb demonstrated. That's where the top block will go. Now, the bottom block goes on your butt bone called the ischial tuberosity. And you can feel right where the tip of that bone is, where you sit, your sit bone, and you're going to place that like so. Okay, so that's the placement of the wedges. Now, the book shows it demonstrating this way. Now, either one is appropriate. The problem with it is that if you tried it, you'd have to spend another 20 minutes on the blocks, another 20 minutes on the roll. But if you do the roll, would you hold that for me, Angie, right there? Good. And you do it like so, you can do them at the same time. So it saves yourself 20 minutes. And I'm a fan of saving time as best we can because there's a lot of work we have you doing. So again, the placement will be here. Go ahead and put your hand on your hips again so they can see. Hands will be here, the placement will be here or here, depending upon how the doctor recommends it. Now, you can increase the intensity by pushing them closer together, or you can decrease the intensity by pulling them apart. So if you're finding these a little bit uncomfortable, pull them apart. If you're not feeling much of a stretch, push them more together. Okay? So that's on the wedges. Now, the next thing we're going to talk about is actually the wobble cushion. So Angie, go ahead and step away for a second, and I'll bring you back in a second. Now, the wobble cushion is no different here than at the office or at home. And again, you're going to do all the exercises, and it's all laid out on number and quantity and everything else. And this is the mix part. This is where we're getting the spine flexible and able to move easily by our corrective adjusting. And then the locking part would be more of the wedges and the whatnot there. Okay, another type of mix actually is using the neck traction. Now you can do the neck traction off of the wall, as it's described in the book. And again, the staff member will recommend you do it off the wall. You can do it standing, sitting, any number of different positions, depending upon what has been recommended. Now, these donuts, as we call them, are used at various positions, and we'll make that recommendation. They can be pulled apart, like so, and just use the thinner part, or they can be pushed together. And again, depending upon the damage we're seeing in the spine, you want to be pushing them together or pulling them apart, okay? Now, off the wall, again, I'm not going to show you how to hook that up on the wall. Just follow the directions, and any confusion, ask a team member. But that's going to be hanging off the wall, and again, you'll do just like you do in the office. Now, again, there may be a different recommendation, okay, depending upon what the doctor wants you to do on your warm-up exercise. So you can have these, and again, you put your donuts together or pull them apart based upon what the recommendation is. And what you're going to do is you can push downward, depending upon what the doctor recommends. I call it the 30-degree down bubble. Now, when you do it, don't be pulling your shoulders forward. You want to try and keep your shoulders set and push and lean backwards. Okay? The other way, it'd be straight out, and again, depending upon it is, or you can actually go upward. If you're having struggles putting it on the wall, you can just do it this way as well. So push and relax. Push and relax. And you can do this while watching television, just sitting at home, and just make a habit of it. Put it next to your nightstand and just do some exercises while you're watching. And do as many of these as you can and as many wobbles as you can to get your spine as flexible as you can. All right? Now, as it relates to various exercises, I'm not going to walk through all of those, but I'm going to demonstrate some. You have the CD exercise where you'll be pushing, and again, the important part is to keep your head neutral, not tipping in the direction. And again, it'll be one-sided most of the time, and again, you're going to push. Now, it doesn't look like I'm doing anything until I move my hand, and it falls, you see? So you're going to want to push and release. Push and release based upon the repetitions. Now, this is another one, the alar ligament exercise. Now, the book demonstrates like so. Now, my shoulders are not the most flexible, okay? So when I do it, I actually just put my hand here and turn. And there's a lot of demonstration, but the idea is you want to be turning your head while you're pushing, just like this in neutral posture. And those will change throughout the course of your care. All right? You're also going to be using your cervical traction or your head weighting, just like you do in the office. We're going to start off with the bars that are recommended in your book, and you'll simply Velcro it just like you've done before in the office. That'll change up through the course of care as well. All right? You're also going to be getting your Align Your Health book, and we encourage you to make sure and read this book. On page 167 is an example of the diet we want you to start using. In the back, guys, are all kinds of wonderful recipes. And again, this is going to help you move into a good direction with your health. So read through the back. The majority of the back of the book are just recipes that we want you to get busy doing. So start reading that and start applying that. We're also going to encourage you to use one shake a day. Now, that's the beginning part. As you progress, we're going to make some changes necessary. But one scoop with a glass of water. Now, you can also use some coconut oils, or some coconut water. You can use any almond milk, a lot of different strategies. If you're going to use regular milk, we recommend the Alpha 2 milk, which is the closest to breast milk, and it's organically grown. It's from an organic cow and so on. But simple water is just as easy. Now, you're also going to get an exercise. This is fitness now, fitness exercises. Okay, and on the bottom of this bookmark, as we call it, is a registration code. You register for the Max T3, and you do that in very simple Max T3 3 times a week. Now, you're only going to be doing it for 12 minutes. Please don't do every exercise. We've had patients do that and come in sore as heck. But this is part of that whole process. So remember, we're a 5 Essentials office. We have nervous system, which we discussed a lot here as it relates to your spinal correction. Nutrition, we got the nutrition, the page 167, the back of the book. We've got fitness, which is critical, which is your Max T3. Detoxification. For right now, we want to do your best to minimize your toxic exposure. We'll be getting you some detoxification protocols on that as well. One last thing I'm going to demonstrate for you is the use of the other things that are quite confusing is the band. And again, you're going to do this only on one side because of the position and curve of your spine. So what you're going to do is you're going to wrap it around your leg like so. And again, you're going to lift this side over here and put the other one around your foot. Okay? And the way I recommend you do it, I'm going to slide over a bit. And we're going to go up, out, in, and down. And that's one repetition. One more time. Up, out, in, and down. Okay? So, guys, that's pretty much your home care. And again, twice a day, 7 days a week. And we're going to encourage you to do that, and you can help us help you get you better quicker. So that's a nice quick video on your home care. Please apply it. If you do have questions, again, you have a lot of help from various doctors, staff members, anybody can help you. Thanks for listening.